Did an umbilical cord prolapse cause an injury to your baby? Want to know what I'm talking about here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I am a childbirth injury and medical malpractice attorney practicing law in the state of Maryland. And I would like to quickly talk with you today about a very important and serious medical condition called umbilical cord prolapse. Now, what is this? What is umbilical cord prolapse, and how can it, in certain situations, cause an injury in your baby? Well, essentially, the most common way that you see umbilical cord prolapse is when the umbilical cord is delivered ahead of the baby. Yep, that's it. That's the most common way that you kind of see it, in which the umbilical cord, it comes out before the baby. Now, when this occurs, this is where you can have problems. The main threat to the baby is a compressed umbilical cord. Remember, the baby is also coming down also. So the baby can come down on top of the umbilical cord. The umbilical cord can get compressed as the baby is making its way through the birth canal. When the umbilical cord becomes compressed, now we can have a serious threat of injury to the baby due to a reduced level of blood and oxygen. So once you start having a reduced level of blood and oxygen getting to the baby, now we are talking about possible fetal hypoxia or hypoxic ischemic encephalopathy, which is essentially a reduced level of blood and oxygen causing a brain injury. So when we are dealing with umbilical cord prolapse, where problems can occur is when doctors, for example, they fail to notice it or they fail to appropriately treat the condition. In addition to that, it can be a situation in which the electronic fetal heart monitor, which is a very important tool when we are talking about a vaginal delivery, the electronic fetal heart monitor can sometimes alert doctors that you could have a cord compression situation going on because the baby's heart rate will suddenly drop. And so you can see this drop on the strip, and there may also be some other things there, some late decelerations or minimal variability and some more other things. But the strips can sometimes show these types of things, and problems can occur when doctors fail to react or they do not move on an emergency C-section fast enough. And if they do not appropriately deal with the situation, then you have a chance of the baby suffering a brain injury. So why have I taken the time today to talk with you about this really important information? Because more than likely, if you are watching this video, your baby has suffered a brain injury and you have concerns. Maybe you do remember that your umbilical cord, it was delivered first, and that you now have questions. You're wondering, was there a reduced level of oxygen getting to your baby? You're wondering, was there cord compression going on? You're wondering, did the doctors appropriately deal with that situation? And now you know that your child has a brain injury, and maybe there's a subsequent cerebral palsy situation coming up, and you're just wondering, how is your child going to deal with some of these future challenges? If you have this going on and you would like to speak with me further, and your injury happened here in the state of Maryland, this is what I would invite you to do. Go ahead and pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer Maryland childbirth injury and medical malpractice questions just like yours all the time, and I'll be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I am one of the childbirth injury and medical malpractice attorneys here at Boston Law Group LLC, and we will see you next time. Take care and enjoy the rest of your day.